really important concept to understand about the DIEP flap surgery is what is entailed in the recovery phase. And it's something that a lot of women are concerned by, and some perhaps even choose not to have the surgery based on their concerns about the recovery. The phases of the recovery are very different and very important to understand. So the first phase is what happens in surgery, and then after surgery is when you go home. Then when you go home, out to when you can go back to work, and then finally when you feel normal again. So recovery is not just one word and one amount of time. And if some surgeons say it's 6 weeks, well, what is happening at 6 weeks? So I wanted to go through it in a lot more detail. So let's start with what happens when you're in hospital. So the surgery takes about 8 to 10 hours on average for bilateral breast reconstruction with a DIEP flap, about 6 to 8 hours for one breast. The duration of surgery is something that worries people because they think a long operation equates to a really invasive or a really severe operation. You know, people in the public ask, how long was the surgery as a proxy for how sick were you? But the reality is the surgery is long because of the fine work that we do. Rejoining blood vessels takes time. Using microsurgery takes time. And it's something which, you know, I equate to being on a long haul flight. You know, the takeoff and landing are the dangerous parts of flying, but not when you're on autopilot. So the duration of the operation isn't of itself a big risk factor for a bad outcome or anything like that. So the length of surgery is something people are often concerned by. I would also mention the amount of time in hospital after the surgery. Patients who have the DIEP flap operation with me don't go to ICU routinely. They go to the ward where they have their own room and they have the ability to recover in some small amount of peace and quiet. But it does require a lot of intensive monitoring, which can make people's sleep really quite patchy for the first 48 hours. So a lot of people who've been through this operation say the first 48 hours was the hardest part. Once we've stopped monitoring the flaps as closely, people can get out of bed and move around more freely and they start to regain their independence. But it does take about a week on average in hospital before you're able to go home. Once you do go home, you're not doing too much just yet. You start to go for long walks and start to move around. But you're not back to doing normal things like work until between 3 and 6 weeks after the operation. And I usually say it's best not to drive a car until you can move your abdomen, move freely, check blind spots safely. And that's usually not till about 3 weeks after the surgery or 2 weeks after you've gone home. So as people start to recover, they start to be able to do more exercise, initially walking, moving around. At 6 weeks, however, we start to say you can do most of the activities you would have liked to have done before. Start jogging, swimming, getting back to doing full days of work and caring for, you know, your family members, your children, like you were beforehand. Other than during that 6-week period, there shouldn't be anything that you could do beforehand that you can't do after a DIEP flap. You know, we take great care in making sure that the abdominal muscles work as well as they did beforehand after the operation. And certainly core muscle strength is something that we hope shouldn't be impacted by this operation. Exercise, all of the activities people like to do for work and for their family life should be the same after as they were before. We do recommend rehabilitation. Some people don't have strong abdominal muscles before the operation, and so it's important to recognize that that's going to take some rehabilitation afterwards as well. In certain circumstances, if we have some time, we can even recommend some pre-surgical rehabilitation so that people come into this operation, if they have time for that, feeling as strong as they can. And that helps to lead to a better post-operative course and a better post-operative outcome.